Okay, please help me welcome Dr. Aaron Hartman. Dr. Hartman helps people with chronic health issues restore their health. He's board certified in family medicine as well as integrative and holistic medicine. Welcome, Dr. Hartman.
Lindsay, it's great to be here. Thanks for the invite.
I'm loving this Wednesday morning together. Let's dive in. Can we go personal for a second? Because you have a fun story with adoption and how it changed your career course, which I think is really interesting.
Yeah, well, my wife is a pediatric occupational therapist, and her specialty was kids with special needs. So she had this caseload of really complicated kids that, it seemed like every single solitary kid on her caseload, I'd never heard of their disease before. So that was kind of her bread and butter, was just like really difficult young kids with neurological issues. And one of the kids, when she was about 12 months old, her foster home was closing, and she asked me if I'd be willing to take this little girl in. And so me, I was like, oh, sure, why not? And being a guy, I was always like in the back of my head, we can always give her back, right? And so I just happened to fall in love with her over the preceding time, and we decided to adopt our daughter, who's now our first daughter, Anna. And so we got her. And so during this whole process, actually, before we actually got her, adopted her, one of the things was that kids with CP tend to have a lot of feeding issues and neurological issues. And so the pediatric GI doctor was like, hey, your daughter is too small. You should cut a hole in her stomach and put a plastic tube, a feeding tube into it, so you can pour formula right into her belly to help her fatten up. And so, I know my daughter was never supposed to walk. She was never supposed to talk or crawl or any of those things. But my wife said there's something there. There's more there. And so I just kind of blindly believed, hey, I have better expectations for my daughter, like I guess every parent, or future parent. And so we just didn't want to put a tube in that's going to affect feeding, that's going to affect speech development, that's going to affect crawling, and so we just opted not to do that. And then 6 months later, my wife actually found a pediatric growth chart for kids with CP, and my daughter was right in the middle. And that was like my first aha moment, like, wait a second, the expert at the University of South Florida, who this is all they do, had no idea there was a growth chart for kids with CP. And then that was replicated again with some eye issues and an eye doctor. And that was like my first time I actually kind of jumped off the road, and I didn't actually do what the experts told me to do. And so that was the first of many episodes like that over the last 13, 14 years, where we just got used to saying, no, that doesn't resonate with our values. This is not right. We don't accept your diagnosis of our daughter. And my daughter's 15 now. She's walking with forearm crutches. Her therapist is actually talking about getting ski crutches, because she can actually hold more weight now on her legs. She's progressing, which kids with CP don't typically progress after they're 6 or 7. She's had no surgical procedures. It's actually funny today. She's become our dog whisperer. She actually can hear the dog, and she's like, that's the attention bark, and that's I gotta go potty bark, right? And it's so she's gotten really good with just knowing these kind of things. I play her chess, and she's getting good enough at chess that I actually have to pay attention to the game now. Otherwise she'll beat me. So and so that's kind of like started us off that beaten path. But the result was, as I learned things, I'd see patients with autoimmune issues or neurological issues, or they'd have kids with ADD or ADHD. And I'm like, wait a second, well, there's this prescription fish oil that's FDA approved called Byron to treat ADHD. Why don't we do lipid therapy instead of stimulants for your kid, right? And so that's kind of like the beginning process. And the evolution was that I eventually launched a functional medicine practice in 2017, taking all my knowledge. And then I got, being a clinical scientist, I just wanted to get the right certification. So I got my training and I got my board. And I just kept on learning. And that's kind of where I'm at now, is I'm just kind of realizing there's so I'm in the ultimate practice of medicine, where every day I'm learning something new, practicing something new, and trying to apply it to the people that I see come see me. But what got me into this was primarily my daughter and my family.
Right. Oh, I love this story. And I love that it's creating a career for you where you feel like you're learning every day, and that your eyes are getting opened every day. Because I think that a lot of us can just settle into this, like you said, we'll just accept a diagnosis or accept a plan. And the reality is there's more out there. We just need to keep asking questions and investigating. So what I was loving about your current practice too, I do feel like you look at the whole person, from vitamin deficiency to their eating Do you come up against a lot of barriers with your clients as far as is it hard to address the whole person? Are you getting kickback on that?
But it really depends on where the person's at in their individual journey. Sometimes people come to me and they're like, hey, I want to get my diabetes under control, but they have a busy job and they eat on the run, they eat a lot of fast food. And it's like, I'm not sure, I can't really do an integrative functional approach to your diabetes when you can't change your diet. You're only sleeping 3 hours at night. You're not going to use your CPAP machine, treat your sleep apnea. So it depends on where the person's at. So part of what we do is I just meet people where they're at. I'm not very paternalistic. I'm not like it's my way or the highway. It's like, I just meet people where they're at. Some people come to me and they're like, I am ready to change everything.
Yeah.
And they do. They change their diet. They move because their house is full of mold. They realize they've got these chronic infections. They realize that they're in these toxic relationships that cause chronic stress, which is a huge, huge player with brain-based inflammation. It's stress by itself can induce autoimmune diseases. There's actually this heart disease, actually in women postmenopausally called Takotsubo's cardiomyopathy. It's stress-induced heart failure. It's literally, you can get stressed and you get a cardiomyopathy, your heart dilates. At least we know about these things. So I kind of meet people where they're at and try to just, the analogy I give is kind of the Lord of the Rings. I'm kind of like Gandalf. I pop up, say some weird phrases, and people are like, what do you say? And then you got this team of whether you're a family or a health coach or whoever it's around you that then just kind of helps guide them through that. But it is a journey. And the people need support. They need a team. They need a healthful, significant other. It's really hard. If I see if you were to come see me, for example, and your significant other was like, I'm not changing what I do. I'm not changing how I do it. I'm not stop smoking. I'm not, all these things. It's like, well, all of a sudden now your barriers are those around you. And so it's just a journey. And when you do holistic integrative care, it's not just here are your symptoms and here are your medications. You have 5 symptoms, here's 5 medications. It's like trying to get the root cause. What's causing these? What's at the root of it? And how do we address that? And that's a deeper kind of medicine.
It is. So what is a common client and how long do you have them within your do you get them for years, for months?
I've got some patients, some patients I've been seeing for 5 years. I've got some that come in for a couple of visits and just realize it's not for them. So it's a wide range. People tend, if you stay with me for about a year, people just tend to stay because they realize the value, and especially with all the COVID stuff. It was interesting how many people, like when all this uncertainty hit, it was kind of like they got like their integrated functional medicine doctor in their back pocket, kind of sort of like, what about D? What about zinc? What about the vaccine? I'm one of the clinical researchers on the vaccine as well, with my clinical research company. It's just, I feel like people, it's really interesting when COVID hit, I didn't lose any patients. Everybody stayed. It was just interesting to see how being that source of information, that calm source, hey, we're going to get through this. This is not, the idea of an acute, pandemic. I'm also an anterior historian, so I look back at what we did with past pandemics, whether the Russian flu in the late 1880s or the Spanish flu in 1918, 1920, or the Korean flu, or the Hong Kong flu. We've seen this many, many times before. What's unique is our ability to follow this day by day with gene mapping and things like that. But the idea of, an acute viral infection causing cytokine storm, causing neurological issues, the idea of a post-infectious chronic fatigue and fibro, dysautonomia, all these things, these are actually, your long, mono causing, chronic fatigue, or Lyme causing, post-Lyme syndrome. We have, biological examples of this. It's just being able to translate that information to this new thing called SARS-CoV-2, and then predict how things, and that's kind of what we do in functional medicine is with this some people call it translational medicine. We take also the data and then apply it to a novel patient, new situation. But science is still science, and biological systems are still biological systems. They should act the way they've acted before, And that's kind of what we do.
Yeah, I want to stay on this topic for a second because you're just going to be a wealth of information. I heard this from a client the other day who was listening to another source, and it was somebody talking about the importance of, like, a lot of us have this huge fear of getting COVID and what can I do to prevent getting COVID, when sometimes maybe more the reality is how can we be prepping our bodies for when and if we do get COVID? And that falls into you. Like, what is your common advice to your patients?
Well, I think one of the things you have to realize that a coronavirus, 15% of head colds are caused by a coronavirus, and during flu season, during a typical flu season, 30% of all lung respiratory tract infections are caused by coronavirus. So my expectation when this first started was, well, this is a novel coronavirus, but still a coronavirus. So it's probably going to become ubiquitous. It's probably going to become everywhere. And what in the literature, some literature came out of the UK about 3 weeks ago that verified it's everywhere. It's endemic. We're all going to get immunity to this either through vaccination or infection. And that was something I was thinking about a year ago, but now the literature, and that's where sometimes literature, if you have a biological plausibility based on my understanding of the science is what I think, that precedes sometimes by years or decades, the actual literature that proves your theory. And that's kind of what we do in medicine, we practice. And so about 3 weeks ago, the literature came out saying, yeah, this is endemic. It's not going anywhere. So I think that the conversation is we're all going to get exposed and eventually get this. Half the people who get it have no symptoms. Mm-hmm. Minor symptoms, they have no idea. 0.3% of people, which is the data as of 3 weeks ago, are going to die. Okay, those are mostly those over 70. 87% of people who die from this have low vitamin D level. So all of a sudden now we know risk factors. Zinc. If your zinc is low, which 40% of those over 65 have low zinc, you have a 40% increased risk for hospitalization. So all of a sudden, my perspective is you want to maximize your own individual immune system and resilience. And if you're a 12-year-old kid, this is like a runny nose. It's not lethal. Yes, and there's 500 children across the United States this whole time that passed away. But if you look at that compared to a RSV virus, which happens every season, more kids will die from that in a typical RSV season than have died from this so far. So keeping perspective, I think, is huge, but we're all going to get this. We're all going to get exposed to it. So the question becomes, what are you doing now to boost your immune system? What's your vitamin D status? What's your zinc status? Quercetin, which is a ionophore. If you're familiar with the whole conversation, not to go in that right now with ivermectin or hydroxychloroquine, quercetin acts like hydroxychloroquine. It's an ionophore. It allows zinc to get into the cells. It's also a mast cell stabilizer. And those who have been following some of the literature know that part of the acute and long part of COVID is actually a instability of the mast cells. And that's where the whole Pepcid and Zyrtec thing comes into. When you get in the hospital, you give you Pepcid, right? What they're doing here at the Eastern Virginia Medical School critical care unit, they're actually using this in the hospital because of its ability to stabilize mast cells. So I think it becomes what's your plan to prep you for that? Because if you get the vaccine, you still have a 50% chance of actually getting COVID. It doesn't eliminate that. It's just you have a much, much, much lower risk of hospitalization and death. So it's still, and ultimately, and the thing about it is flu season's coming. To be honest with you, I'm a little worried about our next flu season because every year the flu virus mutates a little bit and we have not had a flu. I've seen one case of flu in the last 6 months. It's just not going, and it's mutated. We just don't know what we're dealing with. And so the question is when that comes through, typically a quarter of the population will get flu in a given flu season. Well, we're going into a third season where this is going to be our third season since this whole thing started. Are we going to have a flu season this year or not? Whenever we do have our next significant flu season, I feel like it's going to be worse because we've gone through 2 to 3 seasons where people have not been re-inoculated with it going through the community. RSV this past summer was crazy in the kids. We were seeing tons of RSV in kids this past summer. So those are my things. So I think prepping people's immune system, knowing there's basic things that anybody can do. There are certain things that high-risk people should, the vaccine, if you're a high-risk individual, you really should consider it, if you're over 65, you really should consider it. There's a debate on safety of the vaccine, but we can't forget that this disease is horrific in the elderly, and it's also not a big deal in a 6-year-old kid. It's like a runny nose, I'm personally getting over COVID myself right now. And when my kids literally my daughter had no symptoms and tested positive and was gone the next day. My daughter was cerebral palsy, who's high risk, right? Had almost both my other daughter has 2 of my kids actually have CP, and she had, a little tired for 2 days, and that was it. It's not a big deal in kids, typically. And that's why I think just reminding people of the information and the data, not trying to scare people, but giving them information. This is what we do in functional medicine. We come alongside people, we educate them, and then allow them to make their personal choices. I still believe, I think this is still America. Hopefully, I think that, individual medical freedom, people should be able to choose what they do to it's your right, it's your body, right? You should be able to choose what you do with your body, right? So that's our mantra, right? So it should be up to you to determine what enters your body. food. Yeah, it's interesting. People, one of the things has not been discussed hardly at all, except over in the UK and in Ireland, strangely enough, is how your diet affects your risk for post-infectious inflammation. If you're eating lots of processed foods and processed oils, and you get a viral infection, you're more prone to it's like if you have a field or area and you put gasoline on it, you still need a spark for it to light, but when it lights, it's going to go crazy. Yeah. And that's what inflammatory foods are. That's what sugar is. And if you actually have nutrient dense diet, nutrient levels are great. When you get that spark, it's like throwing water on your field. It's going to much dampen the risk for this infectious inflammation and post-infectious inflammation, which is what this whole long COVID thing is, which looking at the data, 10 to 30% of people are going to get long COVID,
Describe long COVID. I feel like some know about it and some are just starting to hear.
So long COVID, the technical term for it is post-acute sequela of SARS-CoV-2, which is this crazy. Yeah, I know. If you're, it's like long COVID or, long haulers, but the idea is it's a new name for an old concept. So it's a post-infectious inflammatory condition. Okay, so you get infection, the infection's gone, but you remain inflamed. And so a lot of symptoms are brain fog, fatigue, sleep disturbance, irritability, mood swings. I'm still a little irritable right now, personally, like from COVID. Like I'm still like a little like, like my temper, my tolerance for like kids yelling in the house, the dog running through the house. It's like, I'm like, stop that, So like I'm still not back to, but things like that, GI upset. Weakness, fatigue. These are all parts. And if you look at a lot of these things, there's literature last year about COVID causing chronic fatigue and fibro, COVID causing POTS or dysautonomia. And so that's where, that's kind of where this long COVID thing fits. And in the functional medicine world, we've been dealing with post-infectious inflammation for decades. This is kind of our bread and butter with people with chronic fatigue, fibromyalgia, people with chronic Lyme or post-Lyme syndrome or chronic inflammatory response syndrome, which could be related to Lyme or other things. So this is kind of like to be honest with you, it's like our bread and butter.
Yeah. Yeah. So let's go through like a step-by-step process of all of this for the listeners. If we're rewinding a little bit, when we talk zinc, vitamin D, do you believe that they need to be going in and getting lab work done to just see if they're deficient first, or would you just say, let's start supplementing?
Well, think about it. It's like ideally in the perfect world, you'd have a functional provider who do a complete nutrient analysis on you, check all your vitamins, all your nutrients, because you might have a chromium or selenium deficiency, and that is incredibly important as well. You might have, I see a lot of people with iodine deficiencies, and iodine actually is really important for inflammation, not just thyroid function. But the reality is insurances don't pay for this, and most physicians or providers aren't comfortable ordering labs they don't know what to do with, right? So what happens is they just don't order that. So that's where if you already have a functional person you're working with, you're super fortunate. If you don't, then you kind of just make general recommendations. So my general recommendations are, 5,000 units a day of vitamin D, for zinc are about 30 to 50 milligrams of zinc a day. Vitamin C, 500 milligrams twice a day is a decent recommendation. For NAC, N-acetylcysteine, which there's tons of data on N-acetylcysteine's ability to lower the risk of lung infections and flu, COPD, chronic emphysema. I use it on pretty much all my lung patients. I've got patients with pulmonary fibrosis, if you know what that is, where the lung just kind of gets scarring and they get chronic low-grade infections. I've had great results with NAC. And it's been used in the cystic fibrosis world as an inhaled medication called Mucomist for decades to help lower the risk of lung infections. So it's got a great data profile. I use 600 milligrams twice a day of that. Then you kind of get into the more esoteric stuff like quercetin, which is a great anti-inflammatory. These are all for prevention. And there's a whole list of nutrients I can give you, like resveratrol as well. Is a great anti-inflammatory. Resveratrol and quercetin work well together in these cells called inflammasomes, which are cells that control inflammation in your body. And so that's one of the places where the cytokine storm actually sits in this inflammasome with COVID. So, but the big ones are your vitamin C, D, zinc, and quercetin. I kind of start with that. There's you can see a whole list of other nutrients depending on how much stuff people want to take. And there's also one of the things like your B vitamins. If you look at your B vitamins, 40 to 60% of Americans are deficient in any single B vitamin, thiamine, riboflavin, folic acid, B12. So, and the B vitamins all important for white blood cell function, immune function. There's this translation when you have your innate immune system, which is your more primitive part of the immune system, convert to make antibodies, which is everybody talks about antibodies and all that kind of stuff. Well, the B vitamins are important for that. And so, and if you get too much B vitamin, you know what you do? You pee orange, you pee it out. So they're pretty safe. So usually a good B complex I kind of throw in the mix. And I could make tons of recommendations with different probiotics and things as well, but ultimately it gets kind of overwhelming for people.
Yeah. Yeah.
So
always. I feel like that is where, so that's why I like to kind of simplify it down. I mean, gold standard is you have your integrative team that you're working with, your integrative doc and team, that you would get the whole panel done. The supplements alone, even if you don't have the panel done, are beneficial. And then, like you said, let's really emphasize this whole inflammation, because we can call it post-COVID or long COVID, but like you said, this could be for our fibro patients who really cannot find relief. This is broad. And so when we talk inflammation, let's go into your standard protocol. Besides supplements, what else are you investigating?
Well, the thing about inflammation, the biggest, the foundations of functional medicine, are first is diet. Diet is one of the ways tons of toxins get in your body when you eat processed, gluten, corn. There's a thing called a Bt toxin. Corn is genetically modified to actually create this Bt toxin. So just cleaning up your diet is a huge thing to decrease toxin or inflammation exposure, but then also making it more an anti-inflammatory detoxifying diet. That just means that most of what you eat is plants. If you have a plant-forward diet that's mostly plants, green leafies, and then you supplement that with nuts, seeds, nutrient-dense foods, that's a huge starting point with your diet. Sleep is really, it's interesting. We knew this last summer that if you slept 6 hours versus 8 hours, you increase your risk for severe COVID 40%. So what's your sleep look like, and that's where, if you're, the average American sleeps 6.5 hours a night right now, compared to 8.5 hours in the mid 1800s. The average American, has lost roughly 25% of their sleep. That's an insane number. And think about it, when you get sick, what do you want to do? You want to sleep. Why is that? Because why do your bones ache? It's because your interferon, which is ramped up, is telling your bone marrow to make more T and B cells. And that primarily happens when you sleep. Think about when you don't sleep a lot. Don't you kind of ache a little bit? If you've been pulling a bunch of all-nighters, and that's because you're awake when your bone marrow is trying to make your immune system, right? And so so sleep is huge. Diet, exercise. Obviously movement's really important for your health. Stress. One of the things I'm kind of taking a deep dive in right now is this whole mind-body connection. We talk about your gut being a source of inflammation, but your brain is as well. If your cortisol is high, you get a thing called leaky brain, which is a correlate for leaky gut. Increased gastrointestinal permeability in your gut is a correlate for breaking down your blood-brain barrier. We always call it leaky brain because that is just easier to say than all those other words. And then another thing that's really super important, like your environment, the air you breathe, the water you drink. People don't realize that there's actually, and I did an article about this last summer about the air quality increasing the risk of severe COVID. If you think about the cities like the Wuhan province, Lombardy, Italy, which is an industrial center in Italy where the COVID was the worst, London, New York City, these are places that are industrial centers that have lots of microparticulates in the air. And we have data going back 10, 20 years showing there's an increased risk of inflammation in your lungs. The ACE2 receptors upregulate in your lungs when your lungs have chronic low-grade inflammation. So something like a HEPA filter for your bedroom, depending on where you live, your workspace, that can be really, really important for lowering your lungs risk for inflammation for any infection, not just COVID, but influenza. If you're a smoker, if you're someone who has allergies, 25% of all asthma in our country is directly related to environmental mold.
Wow.
And you figure half of all buildings in our country have some kind of water damage. The environment's a big deal as well. So I kind of start walking people through these basic things, water, sleep, exercise, stress, relationships, and then your environment, which I throw water in there as well, in the air. Those are the basic, foundational things we all should kind of work on all the time.
And don't you find that one ripples into the other? Like if you can get a patient to start sleeping more, it typically helps with their food, it helps with their movement, ripple.
What I usually do is I try to find the place the person's the most ready to make changes that'll have the biggest impact. And to be honest with you, food, everybody knows they need to eat real food. I don't like to convince people like they shouldn't eat fast food. Everybody knows they shouldn't eat fast food, right? It's not like, I have to break their arm and say, really, McDonald's is not healthy for you. But so like that is one of the things they want to go-tos. And it's amazing how people will feel just better. If you have, with like women with really bad periods, for example, with my daughters, if they watch their diet, they take their supplements, they keep their bowels moving, they will have very mild cycles. And when they don't do that, they have the cycles where they're in bed for 2 or 3 days. And it's like, it's, when you get the kind of feedback, and I think because of women's hormones and because you have like this monthly, direct feedback that how was your last month? Your cycle will tell you. How
Right.
heavy is it? How painful is it? What's your mood look like? These are all factors of the lining in your meter building up like the 3 weeks prior and sloughing off. What was your toxin load like? What was your yeast or candida load like? How inflamed were you for that month? Unfortunately, it's focused on those, the 3 to 5 days of the cycle, but you get, women get a direct feedback every month, and then taking that and using that. How do you feel? Your diet was clean this past month. Oh yeah, I didn't really have any headaches before my cycle, and it wasn't. And then just getting that feedback and then expanding it after
Right.
that to everything else.
Right. And being insightful through that whole process. Cause I feel like that's a part of your job too, is once you start pointing that out, that people go, oh, I guess, yeah, I can see that, but don't
Yeah.
naturally always discover it on their own. Uh,
Yeah, I think once people become insightful and they learn about their bodies, it's easier for them to pick up more and more cues. It's just getting past that, well, I'm 40. I'm supposed to feel like that. I'm supposed to be tired. I'm supposed to be irritable. I'm supposed to like sleep poorly because all my friends are like this too. And it's like, well, actually, just because it's the norm doesn't mean it's optimal. I tell people that half of Americans are diabetic or pre-diabetic. That's the stats right now. That's not, it's the norm, but it's not optimal.
right. Right. Well, I am so curious. What do you say to the other professionals who are not on board yet? I mean, I'm sure you do food sensitivity type testing as well. I come against a lot of kickback depending on different professionals, whether they believe in the integrative part or not. Like how do you talk about that?
I think guys have a different experience because I'm a medical doctor doing this. So versus nutritionists or nurses or acupuncturists, I'm already kind of in the system. I'm a assistant clinical professor at the local university. I'm a clinical researcher. I've been in the community since 2007. So it was almost 10 years in the community, seeing tons of people, sharing patients with a lot of the local practitioners before I started doing this. So it almost was like people kind of already knew who I was, and they already kind of knew the way I thought, and we were already referring patients between each other. So my experience has been a little different. People have been like more like, it's been more like dismissive. Well, just kind of Hartman. He reads weird stuff, whatever, kind of sort of. It hasn't been like antagonistic, like, oh my gosh, who is this quack who's
Yeah.
recommending vitamin D? I joined my practice in 2007. I'm at now. One of the partners was like, oh, that vitamin D thing. He's just a young kid. That's the trend. That's the thing, right? It wasn't like, there's no data behind vitamin D. How dare you? You're a quack for recommending D. You might give people kidney stones. Kind of, it was none. It was more like, he's a good kid. He'll get over it, right? And
Yeah.
now
Yeah.
and it's like, and we're still like 2011. We're still struggling with vitamin D recommendations
Right.
now. Like
Yeah.
it's still controversial. I'm like, how is this controversial? We've known about fortification of D in milk since like the 1920s and 30s. Like, how is this hormone, vitamin D is a hormone that actually helps regulate the transfer from your innate to your adaptive immune system. How is this nutrient that in low levels is related with increased risk for breast cancer and colon cancer and heart disease and dementia? How is this controversial still? And I think that's where just, to go back to your question, like my experience has been a little different just because of my how I fit in my local community. But I know a lot of people do deal with, are vehemently attacked for recommending C and D, which are very safe nutrients. 83% of people with skin of color have low D levels. 42% of the average Americans have low D levels. It's a pretty, it's pretty much a given. If you have 2 arms and 2 legs, you probably have the low D levels.
Yeah. Yeah. Oh, it's okay. So thank you for summing that up. I'm always curious. I'm always trying to break down that barrier I mean, my chiropractor was even saying this the other day. He has a brother who is um, a physician and was like, doesn't believe that the food really makes that big of a difference with COVID. And he was like, it's just frustrating because physicians are known as like your gold standard of who we listen to, right?
Yeah.
And so you get somebody who's not on board with supplements or not on board. Now you're pulling your patients in that direction too.
I mean, there was an interesting article that I put out on social media end of last spring. I was looking at why is COVID not that bad in kids? What like wouldn't you want to know like what's unique about kids that when they get COVID, it's like a runny nose, and grandma gets it and she like is hospitalized and intubated for like what's the difference? And it looked at different factors, and one major factor was the microbiome diversity, which is the compilation of all bacteria in your GI tract. And it's one of those things where if you just Google, Google Scholar, microbiome and health, microbiome, autoimmune diseases and cancer, there's this whole new field of research looking at the bacteria in your gut act like their own organ. 90% of serotonin, which is your happy neurotransmitter, is made in your GI tract. 25% of T4 thyroid is converted to T3 in your GI tract. 50% of dopamine, which is the focus neurotransmitter related with ADHD, is made in your GI tract. Hormones, female hormones are detoxified from your liver through your GI tract, right? How many women with PCOS, IBS, heavy periods, infertility, how many of them have gut issues? And the answer is, by definition, all, and so like, it's this really interesting thing. And it's like, what's the primary driver for your gut microbiome? It's your food. So like this massive disconnect between this new field of research, and they're doing stool transplants, not only to treat C. diff, but also looking at that for Alzheimer's, autism, a whole host of different autoimmune disease, Parkinson's. Parkinson's starts in your GI tract 20 years before diagnosis. The alpha-synuclein starts migrating up your vagus nerve and being deposited in your basal ganglia 20 years before diagnosis. And one of the very, very first symptoms in Parkinson's is constipation, because it's affecting the neurons in your GI tract as it migrates to your brain first, right? What drives this whole microbiome thing? It's food. And so all of a sudden you have this cool field of research of something that's totally malleable and can be changed. And there's a disconnect. Well, how does food affect the bacteria that grow in your gut? I'm like, there's tons of literature on that as well. It's just because it's not, I think the big thing is because there's not a drug, there's not a drug that can actually like treat and make this better. And so what happens, it's not put in journal articles. I don't have, drug reps come, prime me on this new, whatever for that. And so it just doesn't enter the consciousness after you've been trained. They're talking about it in medical school right now, but they didn't talk about it in medical school when I was in, because it just wasn't a thing. And it's still not, it's still the microbiome still largely falls in the world of integrative functional medicine. Like we have a lot of tools and a lot of things to work with it, but it's a very holistic approach, requires lots of different modalities, not just diet, but herbals, probiotics, prebiotics, fermented foods, fatty acids. Great example. Okay, I'll stop after this example. There's a thing called TMAO, trimethylene oxidase. It's a enzyme that when it's elevated is associated with increased risk for heart disease. Okay, and you can go, there's the Cleveland Heart Labs, and that's pretty fancy. That you can order through Quest that actually will check for this TMAO level, right? And if it's high, you have an increased risk for heart disease. How do I get this level down? Well, how does it get high? Well, it gets high when you eat carnitine, red meat, yolk, and egg yolks, things like that, with certain bacteria in your gut that break the carnitine and turn it into this TMAO thing. How can I drastically lower this? What magical medical thing do I have that radically lowers this? Extra virgin olive oil.
What?
Yes.
Yeah.
Yes, exactly. It's like, that's not super fancy. And the medical dose is anywhere from 4 to 8 tablespoons a day, which sounds like a lot to you or I, but if you're Italian or Greek, you're like, wait a second, I use olive oil on absolutely everything,
Right.
And so that's the link between one medical food and your gut microbiome and this lab test you can do it, Quest Labs, local thing, and outcomes. And that's what we do all the time in integrative functional medicine, is making these connections and then giving people interventions that affect them.
Oh, that is such a great example. Thank you for that. That was worth. Keep going. Where can people find you? Are you virtual as well as in person?
I've got my one-on-one clinic. I book out like anywhere from 3 to 6 months in my one-on-one clinic. So if they want to see me, I'm just kind of primarily focused on that. I do have a community because there's such a need for this. And there's less than 1,000 people in the country even trained like I am. So it's by definition, just hard to find, this field's relatively new. It's still not recognized. People forget that ER doctors in the ER physician was not a specialty in the 1980s. Family medicine was not a specialty in the early 1970s. Hospitalists, I was a hospitalist in 2007 when I started my practice. There were no hospitalists in 2007, right? And so people there's always new things popping up. And so right now we're in this weird stage where there are people practicing functional medicine, but it's not recognized currently by insurance because there's just not a whole lot of us. So what I've done is I set up a community online where I've got, coaches. I got my nurse practitioner. I put some classes in there. I do like a Q&A stuff. And so it's providing people that guidance, the information to start making their own changes. And it allows people to kind of do their own kind of do it yourself, where they come and they learn about inflammation, they learn about your gut health, they learn about detoxification. They're in a community of people who are working through it. Like, how did you figure out where you got your food from? How did you figure out your mold issue in your home? They can ask questions, to me as well. And then, that's like for people who don't have access to functional medicine. And then I'm just like a lot of like the free educational stuff, because this is largely, educational. I've got a book reading list on my website. And I've got people like, Dr. Fasciano, he's a GI doctor up at Harvard. I got one of his books on my reading list. Dr. Mark Hartman, who started the functional medicine clinic at Cleveland Clinic. I've got like a lot of big name people, like books they've written that I feel like would be helpful for people to kind of get some buy-in. Because ultimately, I feel like that's the thing is like it takes repetitions and mother of all learning. It just takes time and repetition. So I've got a book thing. I've got some blogs I've written, a whole bunch of just free information for people, and they can sign up for my newsletter as well. Every week I put out a newsletter about some new topic, whether it's, new advances in COVID or whatever, new nutrient stuff. And so I'm trying to always educate people because I feel like that's where we're going to win the battle of getting people to kind of realize that what you do radically changes your health. You can change the trajectory of your health. I have a patient, is a nurse, came to see me, 5 or 6 years ago, and she had a positive ANA, her joints hurt. And she was worried about lupus. And as an ER nurse, she had seen people come in and dialysis from their lupus. And so she was like, I do not want, what can we do? And with her, she was totally primed, totally ready. And we basically did an all-immune paleo diet with her and a few nutrients. And over the period of a year, her ANA normalized. It's been normal for the last 4 years.
Wow.
So when you see that over and over again, you're like, wait a second, you can change the trajectory of your health. You can, if you're just given the right tools. And most people, to be honest with you, if half of all chronic disease in our country can be directly attributed to eating processed foods. And if according to the Harvard School of Public Health, 80% of heart disease and 70% of cancer can be prevented by diet and lifestyle alone, then the primary driver or changer is actually the individual themselves. And that's where I try to educate people. And because most people can actually do this on their own if they're given the right tools and the right information. And then for the people who want to come see me, I've got that as well. So.
Oh, I love that. And again, that step-by-step process to be able to like integrate into your community and just start to get a feeling with it and then continue to take those steps. Thank you. You are wonderful. And I will put everything in the show notes to make sure people can get to all of your resources. I included will be following your blog. That sounds
great. Thanks.
Yes, truly. Thank you for your time today. I know technology has not been our friend. So we're going to end while we are on a high note. And come back and see us. Okay.
Great. Thanks a lot.